Good afternoon, everyone. Thank you for attending this afternoon's webinar for the month of June, Lifestyle Support in Menopause. We'll get started here in just a moment, but before we do, we have a poll question that I'd love for each of you attending to actually interact with if you don't mind. We'll leave the chat section open as well for any particular additional items you'd like to add. But the question for today was, do you feel supported currently in your menopause journey? We'll leave that question up for just a minute before we start with introductions and kind of get into the discussion part of our presentation today. Again, thank you so much for attending Genev's webinar. Seeing a lot of responses already. This is great. Currently just admitting some more individuals in. Again, we'll get started here in just a moment. For those that just joined, we do have a poll question. We'd love for you to take a moment to complete for us. The question was, do you feel supported currently in your menopause journey? Which is very apt, as today the presentation will be on lifestyle support in menopause. And so we just wanted to gather some information and feedback around our current attendance list and how you currently feel supported, or if you are sometimes feeling supported. Generally, it looks like right now 24 responses. We're sitting at sometimes feeling supported as the kind of leading answer. Thank you again for those that have already inputted your answers. For a few of you that had just joined, we'll get started here in just a minute. We just put up a poll question related to today's topic of lifestyle support in menopause. Our team here really just wanted to know if you're feeling supported currently in your menopause journey. And again, we'll get started here in just a minute. Still seeing some responses come into our poll today. Looks like we're seeing no and sometimes be the leading answer so far to do you feel supported currently in your menopause journey. Well, I hope today and our lifestyle support menopause webinar that we can hope to maybe change that answer, or at least start the trend for that answer being a little bit different at the conclusion. It's our hope, at least, that you would feel a little bit more supported after we're able to do this webinar for you today. So I've admitted everyone so far in the lobby. We have the poll question being answered. What I'd like to go ahead and do is just kind of get things started today, so we leave enough time not only for the presentation today, but also any particular questions that our attendees might have for myself or Jessica. But as you can see here, I am joined today with Jessica Gingrich. I thought it'd be important to do an introduction not only for myself, but also Jessica, as she is a newer presenter to the Genev webinar experience thus far in 2024. But my name is Tyler Rouse. I am the Senior Account Manager of Partnerships here at Genev. And like I said, I am joined by Jessica Gingrich. She has been a registered dietitian and nutritionist since 2015. She received her bachelor's from Cornell University in Natural Resources and her master's in nutrition from Bastyr University. Alongside this, she brings with her years of experience building health with clients through holistic and integrative approaches that includes food, movement, stress, and sleep. And I think it's also important to call out. Jessica is currently meeting with a lot of our patients in her role today at Genev, and we'll talk a little bit more at the conclusion of our webinar around how to kind of take the next steps to meeting with Jessica or one of our other registered dietitians. Before I kind of hand the reins over to Jessica, I wanted to kind of give a few promptings, some webinar need to knows, if you will. At any point during the duration of our webinar, if you have any questions whatsoever in regards to a topic that Jessica is discussing or something maybe that comes up around your own unique journey in menopause, we'd love for you to leave those questions in the chat or the Q&A portion of the webinar. We will gather those for answering at the conclusion, making sure that Jessica or myself are able to answer those. And as a reminder, please stay muted during the duration of the talk. I'll do my best to try and keep everyone muted, but if you accidentally go off mute, if you could just check yourself just to be sure. And again, if you haven't had time to input your answer to the poll question that we had kind of kicked the meeting off with, again, do you feel supported currently in your menopause journey? Take a quick second to go ahead and fill that out. And then with that said, I'm going to go ahead and go off camera, go on mute, and let Jessica take things from here with her presentation.
Thank you so much, Tyler. I appreciate it. And hello to everyone. I'm very excited to be here virtually with you today. As Tyler mentioned, I've been a dietitian for coming up on 10 years now, and I've been with Genève since about 2020, working with hundreds of patients and establishing relationships all the way from 1 or 2 appointments to I have some patients now that I've been with for 3 years. So there's an incredible scope of development in what I have experienced here at Genève, and I'm really excited to share some of that information with you today. So the goal ultimately of Genève is to provide care, to provide resources to those who are going through their perimenopause journey, or for those who are looking to support those going through their journey. But one of the other goals is to make it okay to talk about menopause. And that's why I love opportunities like this. Just bring up the conversation, elevate up information, evidence-backed information, and start the conversation going with a new group of people. So I'm very excited to kick off. And here you'll see our agenda for today. So starting off first with who we are and what Genève does, and then transitioning into what is going on in your body. This is a question that comes up a lot in our patient appointments. What is happening? Why is it happening? What can we do to help it? So just touching on, what's going on. Transitioning into some insights and advice, the idea of how can we go in this journey from surviving to thriving. What's it like working with myself or another Genève dietitian? RDN stands for Registered Dietitian Nutritionist. Navigating the journey. What might a journey look like as you come on board and how you feel supported so that you can answer a poll question like that says, yes, I do feel supported on my menopause journey. And then this last bullet says lifestyle strategies. That is also sort of peppered throughout the conversation and the presentation as well. Some ideas for support. So we'll transition now to our first slide of who we are. We are the largest national menopause provider here at Genève. And here's a slide with some information and details, some fast facts. I do want to call out a couple of key points here. I know this is a full slide, so I won't go through the whole thing. But here at Genève, we're very, very proud of our Net Promoter Score of 97. We've all seen those surveys pop up, sort of scale of 1 to 10. Would you recommend us to a friend, a family member? And really high rating. And that relates to the relationships and the collaboration that we really emphasize in terms of caring for our patients. That also, of course, correlates to 89% symptom improvement. So experiencing menopause comes absolutely with symptoms and with challenges. And really, we think about the symptom improvement scope in terms of how things are actually feeling, but quality of life, right? And how that relates to just how you're feeling in your journey, in your body. Lots of collaboration. We have about 7 appointments per patient annually. And I will say on the dietitian team, that tends to be quite a bit more. We as dietitians have the great opportunity to work with our providers for a little bit more time and generally on a more rapid schedule. But lots of connection points here, lots of availability. So services that relate to virtual OBGYN care in person through our integrated networks, registered dietitian and health coaching, conversations about weight concerns, as well as focus on behavioral management, or behavioral health, excuse me. Obviously, expanding plan coverage there at the bottom, always working to provide as many women and those born with ovaries with the care they deserve. So we have over 50 providers, over 50 states covered, not over 50 states, 50, 350,000 menopause assessments that have been completed. And so this is our digital assessment that has been taken by obviously this large number of individuals, giving us information into what are the primary symptoms you're experiencing? What is the impact on your quality of life? 500 medically reviewed education resources, which is a lovely long clinical way of saying really great website content in terms of learning more, and training programs as well that support DEI. So those are our fast Genev facts. Tyler, I'll have you transition to the next slide. So here you'll see at the title, we have common menopause symptoms that Genev treats. I wanted to kick off with this slide. One, just to note the scope of what we might be addressing as we're working with patients, but also to note the scope and diversity of symptoms that one is experiencing or has the potential to experience as they're going through their menopause journey. And this is not an exhaustive list. When we think about the changes that are happening within our body, it's primarily related to the shift of hormones. And we have estrogen receptors all over the body. So there is the potential for impacts to show up in really diverse ways. Now, movies, our socio-cultural experience will tell us that during perimenopause and menopause, women will get hot and irritable. Right? That's about it, right? Cool down, chill out. But that's really not the case. Through our menopause assessments, we see that hot flashes show up about the fifth most common symptom or the fifth most impactful symptom that women are experiencing. And other things may be showing up, like changes in urinary function, GI changes, gastrointestinal changes, brain fog, fatigue, lots of fatigue, right? And one, too, that really doesn't get talked about enough. There's sure some irritability, but many, many individuals are experiencing spikes in terms of anxiety, depression, resurgence of PTSD that may have occurred prior to these hormonal changes. So this is not just about kind of sucking it up and getting it through. There can be really significant life shifts and changes that are occurring in the body. And for many of my patients, they'll say, I didn't realize I was in perimenopause until many years later because it was just hard to kind of pin down the scope of what was going on. It's really hard to go, oh, obviously, it's perimenopause because insomnia can show up for a variety of reasons. GI symptoms can show up for a variety of reasons. So I wanted to provide this insight just to kick off and sort of go, there's a big scope here, and one that we really want to give space to in every individual's experience. Next slide, please. So, what's going on in your body? This comes up a lot. And just to kind of go biophysical for a moment, there's many reasons why you might be experiencing changes, but they do root primarily in the hormonal shifts that are occurring as your body is going from premenopause to perimenopause to postmenopause. So let's get some definitions going. Perimenopause is the start of the hormonal shifts where primarily estrogen and progesterone levels are vacillating, I call it the seesaw, and lowering, right? We're starting at one level and trying to get down to a lower level, but it's not quite as linear as one might hope it to be. So there can be some vacillation. This is the process that the ovaries are going through as they're moving into quote unquote retirement. And most individuals with ovaries are experiencing the symptoms, most symptomatic in late 30s, early 40s, 40s into 50s. That being said, there is also the experience of surgical menopause, where ovaries may be removed for medical reasons, in which case that period of time where you're going from higher hormonal levels to low, very rapid, very fast, and a very intense experience. So perimenopause, that start of that hormonal transition. Menopause itself is the one single day, the 12-month anniversary from the last menstrual cycle. And the very next day, one is postmenopausal. So symptoms may start to wrap up prior to that period, or there may be a year or two as things are leveling out. For most women, they're experiencing 1 to maybe say 5 years. This is not my area of expertise in terms of length, but I'll say in terms of what I've worked with clients. And so there's some really significant shifts in physiological changes that are occurring. For example, many of the women that I work with note that the experience that they're having in their body is a shift to storing more abdominal fat. That is a physiological shift that is occurring. It's not because something you have done has caused this change to happen, but rather as estrogen levels are changing, our body is changing where it stores fat. Also happens to be storing it in a place where we as a society really struggle with for very many reasons. So there's all these physiological changes. And then there's some longer term changes that we think about. things like impacts on bone health and cardiovascular health. So, as dietitians and doctors, we often hear from our patients, nothing is working anymore. What I used to do just doesn't work. And I'm feeling really frustrated by this experience. To which I say, yes, that is real. That is real. And yes, the things that you were doing before probably are not working now because you may have lived in your body for 40, 50 years, but you have not only lived in this body, this hormonal body, perhaps for a couple years, and we're still learning from it. We're taking the evidence and the science knowledge through guidance and strategies, applying them, and then going, okay, what is this body telling us? What are we learning from it? And how can we take the information from your hormonal state now and apply it to what I call the scaffolding of you? Right? If we think of a building, scaffolding is built around a building to help it grow up and grow stronger to build it. It's not changing the inside of it, but it's supporting it. So, how do we build the scaffolding that allows you to grow taller and stronger through this experience? Next slide. Thank you. So, how do you go from surviving to thriving? You know, menopause and perimenopause, the timing is not ideal, particularly these days, because there's a lot going on. And for many, many of my patients, this is a time frame where you may also be raising children, dealing with aging parents at the peak of your professional career, or dealing with big life milestones, moving, changing homes, divorce. All of these things are happening, and then the body may start to shift. And it can shift from feeling like I'm just surviving day to day, but I want to go back to that feeling of thriving. So, in that feeling of thriving, we often connect with our patients and say, let's think forward, right? Thrive forward, live forward. Not to ignore right now, but rather to say, let's acknowledge that what was before this hormonal period was. Now we're going to readjust, retrain, retool your body into thriving now and forward. And so there's some reality to the fact that it can feel really unnerving to go through a change when there's no end zone, right? There's no sort of goalpost that we're going for. Menopause will end. We just don't know when, right? So, what does it mean to travel this journey with someone who can support you through the process, who can hold space for you, give you tools and suggestions? You know, what that means is it doesn't change the uncomfortable nature of how going through menopause can feel, but it can provide you with a productive space to be heard, to be supported, and be cared for. And that's really where our team of dietitians and our MDs, of course, are always here to support you. So, our fabulous team of dietitians is obviously great at nutrition. A registered dietitian nutritionist is a nationwide medical provider training and licensure. So, we've got nutrition nailed, but we don't really see the menopause experience as being siloed to food. So, it's not something that can be fixed with food, and it's not something that was caused by food. But food is important too. So we think about the finer details of your experience. Trained in menopause hormonal changes from our team of MDs, particularly our Chief Medical Officer, Dr. Dunsmore Sue. What are the transitions that are happening? What is the evidence that tells us why they're happening? What are the lifestyle changes that fit in? We have that training different from, say, a registered dietitian who may be coming out of their training program specifically for nutrition or dietetics. And so we're exploring with our patients the holistic experience of them, right? What are you eating? How is movement affecting you? What's the sleep concerns? What's the stress concerns? Other factors that may be showing up in how they are showing up today and in the other days outside of our appointments. So the last bullet here, I think I've been touching on sort of inadvertently, but it's creating space. Right? We hear so often from our patients, I feel better already having just talked the first time with you, because this is the first time, as many of you noted in the poll, you felt heard or felt supported or felt like someone is understanding that your experience is different than it has been before. So that is an extraordinary value that both our dietitians and our MDs are really focused on here in this journey. All right, so this slide has a lot of bullets and I have a lot written down, so hopefully I won't talk too much here. But I wanted to give some details of what it might look like to work with a Geneva registered dietitian. And so we really root ourselves in evidence-based strategies. You know, what does the science tell us about the experience, but also personalized recommendations. You can't cookie cutter menopause. You know, I think of the bell curve, and the reality is that you're going to fall somewhere on that bell curve. Maybe it's on the higher end of really intense symptoms that came hot and fast. Or maybe it's on the other side of, well, I really didn't have all that much happen, but I had these things that really impacted my quality of life. Or maybe right in the middle, right? Some things show up, some things don't. And so, really understanding that, you know, nutrition as well as menopause science is a science, but it's also an art because you are the only one living in your body, and we can only apply the right recommendations that fit to your needs. And so, what are some of the bullet points here? The first one, meal, snacks, and recipe recommendations. One of the most common things that we see with our patients coming in is the changes in body weight, composition, size, and shape. And again, like I said before, noting that the things that you've tried in the past just really aren't working anymore, or finding that the time frame that your body is responding is really different. And so knowing that is there some physiology behind that, we can also take a step back and go, okay, well, we also know from this nutrition perspective, focusing on consistent, adequate nutrition, eating frequency over the course of the day, making sure you're getting in nourishment first and foremost, and then thinking about the balance on the plate. How do we support nourishment? How do we give you tools in terms of making you feel well nourished to support those longer goals? So, for example, I hear a lot from my patients I could eat whatever I wanted, whenever I wanted in my 20s and 30s and be fine, have the energy I wanted, the body shape I wanted, the body size I wanted. Yeah, that is the case for some bodies. They really go through a transition through perimenopause due to those hormonal shifts. I call that tolerance range shift, right? Your tolerance, most of us know understand this in relation to alcohol. In 20s, maybe it was a lot higher. In our 30s, it came down a little bit. And then in our 40s, it came down even more, right? That happens in all sorts of things in terms of how long can you go without eating before you start to feel hangry, right? Or how much nourishment do you need before a workout? How do you need to think about the balance on your plate so that snacking doesn't show up later in the day in a way that sort of overpowers the goals of earlier in the day? So, how can we find the right meals, snacks, and recipe recommendations to fit you? One caveat I do give is we don't do meal plans. I joke we are teaching to fish, not handing over fish, because ultimately a meal plan just gives you some initial tools. And what our goal is to really build a foundation where I can feel comfortable feeding myself and safe with food and carry that forward into life. Menopause specific physical activity guidance. Now, I have patients that range all the way from I don't move at all, I'm really desk bound and sedentary in my job, me, to I'm doing really intensive workouts 7 days a week and I'm still struggling, right? And so there's a wide range of where you may show up in your journey as well. But we do know that there's some key strategies to help optimize lean body mass, muscle, and bone health, as well as cardiovascular health and mental health. So, this is the time to lean into strength and resistance training, but still rooting in what's appropriate for you and your body, right? Some of my more sedentary patients, we may be just moving into walking, thinking about body weight movement and fitting it in through the course of the day. Some of my more intensive athletes, we may be focusing on how to build in mobility and rest and make sure that your nourishment post exercise is appropriate to really get the most out of that muscle recovery and pre exercise to actually get the most out of the workout itself. Sleep support, stress management, and mindfulness. Now, these are big bullets, right? And things that you don't necessarily think of coming up in relation to a dietitian or nutrition training, but they're pretty significant in the perimenopause experience. We know that sleep can be influenced by a lot of factors in relation to sleep hygiene, but also in relation to those hormonal shifts. And man, nothing works when you are not sleeping. Right? We feel exhausted, sleep deprived, brain fog gets worse. And so, in today's world of screens, high chronic stress, yeah, we can all absolutely use some sleep guidance tools like how to make sure we're going to bed at the right time, recognizing revenge sleep procrastination and why it's showing up, and the other tools that we can use. How to set boundaries around work or family care so that you can care for yourself. All of those things relate into how we're nourishing in that bigger picture. And for some women, the hormonal impact of estrogen on sleep is pretty significant. And that's where collaboration with a doctor, if it's appropriate, for some medical management in terms of hormone therapy or other solutions, because sometimes we just can't get up and over those physiological change hurdles. I also mentioned the ill timing of perimenopause, right? We're peak in terms of performance. And so that can be really challenging. One of my most powerful strategies that I have found with patients is the check in, right? Just more often over the course of the day, check in with yourself. Like right now, I'll do an example for myself. What am I noticing? Oh, I'm noticing my heart's beating kind of fast because I'm doing a presentation, but I'm not really holding too much tension elsewhere. My throat's a little dry. I'll probably get a drink in a second, right? Do I need anything right now? We're so prone to just go, 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 go. But perimenopause is an amazing time to stop and start to reflect inward and find those tools again to help build our scaffolding and grow us taller. Showing up for yourself, man, it's powerful. And sometimes it just means going, how am I doing? And that's a great stress management strategy. From there, following bullet wrote supplement audits. Man, if there isn't a supplement for everything these days, and the supplement market is really unregulated. And so as dietitians, we are trained in the process of looking at supplements that you are taking, determining are those appropriate? Should they be in your routine? Are there any contraindications or concerns? As well as thinking about what might be beneficial to add in your journey, whether that's with a hormone therapy journey, without. And so I call these all out as the strategies and some examples above. And then as we think about the bullets below, well, how does that actually manifest? So anywhere from 30 to 50-minute appointments, depending on if they're initial or follow-up. Unlimited SMS communication between appointments. So one of the things we are really excited about at Genev and the work that we do is that it's not sort of wrap up the appointment, done, I'll see you maybe later. We're always booking the idea or forward with the idea that this journey often requires more than one appointment and probably a little bit of support in between. So you have someone on this journey with you and carrying forward with you. Obviously, physician communication and collaboration. There's definitely been times where a patient has said something to me about their perhaps hormone therapy or their experience, where as a trained menopause dietitian, I know I think I better connect in with the doctor and follow up on this and make sure that everything's okay. And I can get the patient an answer a little bit faster. Not always, but a lot of times. And then, of course, behavior change coaching, right? As we think about the support that you need and that any individual needs to make changes, it's a little bit more than eat more fruits and vegetables, sleep more, move more. Right? We have a lot of patients that come to us that say, my doctor told me to lose weight. My doctor told me to eat better. It's hard. It takes a lot of support, and it takes a little bit of neural reworking for many of us. So presenting that unbiased party to support you, ask the right questions, and understand what you need in order to go from surviving to thriving. So I've given lots of examples of what in the moment things happening on an appointment might look like. Let's take a step back and look at, okay, what's the journey, the big picture journey here on the next slide. All right, so here we have Allison, and she's been struggling with some weight gain. She's got weight concerns, some hot flashes, and anxiety. Now, at Genev, there's no requirement, but we do encourage starting first with an OBGYN telehealth appointment. And the reason is because this can be a really foundational place to ground in terms of where am I in my journey? What is it like to talk to someone who has menopause expertise? Many patients will share with me that they're at their OBGYN sweating, hot flashing in between two very pregnant women on either side of them in the office waiting room. And that is a wonderful journey, but also can feel a little bit disconcerting or feel a little bit disconnected. So here our OBGYNs are all MDs and have expertise in menopause care. So having conversations like what is showing up on the menopause assessment, are there any medical diagnoses or guidance to consider? Is prescription therapy the right support for you? And then as well a mental health screening. I want to take a minute again to pause here. Allison's struggling with anxiety. I mentioned as well at the beginning of the presentation, we do see a resurgence in terms of anxiety, depression, and perhaps PTSD as we move into the perimenopause experience. Hormone therapy may be supportive, Having a lifestyle support in terms of making sure you're nourished so your blood sugar isn't dropping over the course of the day and creating mood disturbances. All of these things are really important. And it is also really important to have a team member that can support you from the mental health perspective. So that may come with a referral to our partner, our mental health partner provider, LifeStance, in terms of making sure that you have the right support on all fronts for your journey. I think of it like a little nest, making sure you're really well supported. So that OBGYN appointment may, again, talk about medication, may kind of root you in where you are, may converse on mental health screening. And then you come into our dietitian team where we're exploring, like I said, things like how are you feeling in your body? What's going on? How is menopause showing up for you? Let's talk about food. Let's talk about sleep strategies. Let's explore what's going on in your life and how things are feeling in terms of workload today and how that helped you nourish. Real expanse. And that you'll see here that section for the RDN appointment has some iterations underneath it. And that's because oftentimes it is multiple appointments to feel like you're moving towards your goal. Many of our patients find that 3 months is kind of a sweet spot of like, okay, I feel like I'm getting where I want to go. Oftentimes, 1 week, 2 weeks, it's just not enough time, particularly as the hormonal shifts in many ways are slowing down the body's desire to go quickly in this journey. If that psychological appointment, that behavioral appointment is appropriate, right, that is part of that journey. And then following up, typically with our OBGYNs, a follow up within 3 to 4 months, see how things are going, check in on prescription, symptom improvement. If that all looks good, that may be a year appointment before you're connected back in with the OBGYN again, but continual support from the dietitian between now and then. And we also, as you can imagine, there's some constraints to virtual appointments in gynecology. So there may be a referral to an in-person OBGYN for any exams and procedures that do feel relevant for your individual journey. That is the big patient scale journey. So we'll head over to the next slide. And here we again, lifestyle strategies. As I mentioned, this is showing up on the slide, but it's kind of been peppered throughout the presentation as well. So focusing on kind of these big topic areas of nutrition, meal planning support, recipe ideas, thinking primarily, one of the main things that I find a lot of my patients are struggling with is permission to eat, particularly at work, or finding the space to eat. And that is a huge crucial journey of making sure that your body feels well supported and making sure that cortisol levels are not spiking simply because your body's not eating over the course of the day. Physical activity, personalized guidance on strength training, cardio, flexibility. Obviously, as dietitians and as virtual providers, we're not here to give you specific workout protocols, but rather to say, here's the opportunity that you have. Where can we fit in some resistance training? Here are some tools that are available, some online resources, some in-person resources. What works for you? What fits in your budget? What can we help support you with? Supplements, lots to explore in terms of what to take and what not to take. Sleep assessments and stress management. Again, kind of calling out those big changes that might be showing up, or the big factors that might be showing up for you as well. And so I will shift over to the next slide here, and I believe this might be our next steps.
That it is. Yes, my apologies. I'm doing some clicking over here, trying to capture all of the questions that have been inputted here in the chat. So apologize for my delay. Thank you so much, Jessica, for the presentation today regarding lifestyle support. We did have a few questions, but before we jump into those, I wanted to kind of call out as far as next steps, like what you've sat there, you have heard the presentation from Jessica regarding lifestyle support. Maybe this is your first time even interacting with Genev and hearing about all of the services that we are able to provide, and you're thinking to yourself, okay, well, what's next? Well, what we would highly suggest is we'd want you to talk to a physician or one of our registered dietitians. We want you to feel supported, because you probably are thinking to yourself, I really need this level of support. Well, I would take it a step further and say you deserve this level of support. And I think our registered dietitians, along with our doctors, provide the level of care that is really unique in the marketplace today. And I'd love for you just to be able to have that opportunity. And so you can go to genev.com, you can create your account. Creating the account is completely free. Accessing and learning from our educational resources is also free. We have hundreds of resources. Can't think of the word to describe our linkage here. It's a Wednesday afternoon, and the word is escaping me. Besides just our resources and our webinars, but we have some educational pieces here, talking about different topics, ranging from, as you can see here, like hot flash treatment to exercise does more than burn calories, but it's so much more than that. It can be very unique and tailored to a question that you have. We have a search function that you can look through either a symptom or ways to feel empowered and encouraged along your journey. And so we just wanted to call that out and kind of talk through what's next for you specifically. What we'll do is we'll go ahead and kind of jump into the questions and answering portion of today's webinar. I'm going to go ahead and stop sharing my screen, so that allows me to kind of bring up some of the questions that we gathered during the webinar. And Jessica, I'll kind of point these towards you, and we'll kind of go from there. So the first question that I had captured was actually during the what's going on in your body slide, where you were kind of talking through symptoms, talking through maybe body changes. And someone had specifically asked right after you had kind of talked around abdominal fat storage. This individual wanted to know, is abdominal fat storage reversible?
Yes, the million dollar question. And this comes up all the time. And so I just want to first and foremost acknowledge if you are in a body that feels like it is storing fat in a different way, like all of a sudden you have abdominal fat or abdominal fat storage different than you ever have before, you are not alone. And you can absolutely hold in one hand the understanding that this is uncomfortable. This feels really challenging. Feel like none of my clothes fit and I'm frustrated. And also hold in the other hand, I am not 100% responsible for this experience that's showing up in my body. And I say that because reversible is kind of a tricky word. I often share with my clients, like we can influence the amount of fat that we have on our body, but we can't control it and we can't spot control it. And so, for some women, their experience of abdominal fat or individuals' ovaries, their experience of abdominal fat storage may be influenced by hormones, but you may also be cranking at some of the highest stress you've ever had in your life. And we know that high cortisol experiences do tend to increase abdominal fat storage. Right. So, for example, we're in 2024. I have been with Genev through the launch of COVID, through the existence of the pandemic and isolation, and now in recovery. And so many of the women I'm working with are noting that their weight has changed significantly over the last 4 years or so, and feeling like there's a lot of ownership of that. Well, also, going, well, yeah, you've been going through perimenopause, and there was a global pandemic that massively changed many of the ways that we nourish and move and connect and soothe. So there's a lot going on here. So that's a long answer to say there's a lot of things that could be at play. And we can explore supports that support general weight loss, right? How do we support more regular and consistent nourishment over the course of the day, rooted in protein and fiber? And that includes carbohydrate fiber too. How do we support things like high intensity interval training and resistance training that will really crank up lean body mass and help support weight loss as the body feels comfortable with it? And there's probably going to be more fat storage in your abdominal area than there was 10 years ago. And that will probably be part of your journey now. And so I often joke with my team, we're like 75% positivity, support, accountability, and like 25% buzzkill, because there are some realities to how the body shifts and changes as we're moving through perimenopause and menopause. If we think of the idea of puberty, or rather as menopause being reverse puberty, right? If we were to take a 10-year-old and a 15-year-old, we would see very clearly the body changes that occur due to hormonal shifts. we are also subjected to body changes due to hormonal shifts as we're moving through perimenopause. And so, yes, there's ways to support you. And yes, there will probably be abdominal fat that is part of your body experience now moving forward.
Thank you so much, Jessica.
Yeah.
That was a really detailed answer, and I love the intricacies to what that took place. And definitely looking back at the last few years and how that could be an impact. So I appreciate that.
Yeah.
Someone else had asked specific to weight loss medication, but it was, does Genev support weight loss medication in conjunction with meal planning and exercise plan? So maybe
Mhm.
if you have met with maybe a patient that was on some type of weight loss medication, and how you meal planned or exercise, and kind of maybe how you would approach that.
Yeah, that's a great question. And so, I, as a dietitian, my job, as I see it, is to support the journey that you are in and give you all the resources that you need to make the autonomous decision that's best for your life. And so, by that, if weight loss medications are part of your journey, I am here to support you on it. And if weight loss medications feel like they're not part of your journey, I'm here to support you on it. And we'll figure out what's going to be best for you in both pathways. I do have many patients that have come on weight loss medications prescribed by other doctors, and I have had many patients as well come on that are now coming off their weight loss medications and trying to figure out how best to navigate that journey. And so I guess the short answer is yes, we do support that experience. And from the Genève perspective, we are here to provide you with the tools that you need to make the right decision for yourself in a compassionate and logical and supportive way. And with weight loss medications, I feel quite strongly there are providers out there not doing a great job of that. And so we want to make sure that, if you're coming in with a medication, if that's a conversation that you're having in terms of our medical environment, you have the right tools to make that decision. And how do we pair lifestyle with it? Right? We know that if you're on a weight loss medication, data tells us that you are going to do better and feel better if you can support nutrition, if you can support movement. We also know that you kind of need exercise in order to prevent lean body mass loss. And with a lot of these medications, when they're pulled out of your system, we do see weight rebound. So, how do you support yourself as you're going through coming on, being on, and coming off, if that's the case? Was a long-winded answer, but I hope it covered it.
That was fantastic, Jessica. Thank you. Um, there was a additional question. I feel like maybe I can answer this one, but does the usage of Genev menopause support take the place from an insurance perspective of an annual visit to a GYN? I can answer it from my position as the senior account manager of partnerships here at Genev, and then Jessica, I'll let you answer that just from maybe your own perspective as an RDN here for us. But from our perspective, it can go hand in hand, and it's going to be unique to your own journey. I recommend to all of the individuals and the employers and the partners that I work with that it is a unique journey for every single patient that we have, and it might be where you meet virtually with one of our doctors, and that does take the place of your ongoing in-person OBGYN experience, but in other cases it might not. And so I would say um, what I have seen be recommended the most in my position is that it's just going to be an experience, but also a conversation that maybe needs to take place when you meet with us, and how that would look like moving forward. Jessica, I'll kind of turn it over to you to see if maybe you've got some additional insight.
Yeah, thanks for taking the lead on that, because nutrition is, in my expertise, not so much billing. But what I can share is I have many of my patients that have chosen to sort of tag team their OBGYN care. So they may have an OBGYN that does their annual pap smears or is there for, I've known them for 15 years. They're amazing. They also readily acknowledge that obstetrics is their expertise and not menopause. So then they come onto the Genev team and work with an MD to support their menopause journey. There are some people who just fully work with the Genev team until they're prompted by the Genev team to go see a doctor in person. And there are no hesitations to do that if it is medically appropriate. In terms of primary care, like annual well women exams, those typically do need to also follow up with an in-person OBGYN. So that is a division of care that may show up as you're thinking about how to navigate your own kind of plan. In terms of dietitians, we are under what's called medical nutrition therapy. We are separate from menopause care. So from an insurance perspective, we are seen in many cases as preventative care, and kind of separated between the two. So it's not like you have a bucket of menopause insurance that our nutritionists are tapping or dietitians are tapping into. And I will say one of the great things about being a dietitian is we are in the insurance billing world relatively low cost. And so there's, for the most part, some pretty loose guidelines in terms of frequency of appointments. We have many patients that are able to see us every 2 weeks with full insurance coverage. Of course, that varies plan by plan and important to check in with your insurance provider to double check that. But from the dietetic side, there's usually pretty good support.
Awesome. Thank you, Jessica.
Mhm,
One question that I kind of wanted to pose to you specifically as you are
mhm,
meeting with our patients, and for me as someone who does not have ovaries and will not be going through menopause, but I am married and
mhm,
um, have a wife who does have ovaries and will be going through that experience. Tailoring this question, maybe for those who are attending, as how can you empower someone on their current journey who's unsure of how to either communicate or talk with their family? I'm
mhm.
thinking maybe to spouse. How are you empowering your patients to feel encouraged to tell their spouse, I'm experiencing this because of my menopause journey, or I'm in perimenopause and I am, having this type of symptom. I'm curious if
Yeah.
maybe you have some words of advice or maybe some encouragement that you've provided past patients.
That's such a great question, Tyler. And it's funny, we've actually had patients come on to virtual appointments with their partners with them, in a permissive and of course acceptable way to say, my husband's here with me because he also wants to be here and be a support for me and understand what's going on. So literal showing up is a fantastic strategy. But just that, I often talk about that check in with yourself as you're going through the perimenopause and menopause journey, that check in with your partner too. Like, hey, I noticed this showed up on your social media feed as an advertisement, or, you've mentioned perimenopause, or, you've been really hot. Do you think this could be happening? Just that space to say, like, I want to understand what you're going through right now and not fix it, but just go, hey, I'm here and please let me know what you need. Do you need me to just give you a hug? Do you need me to be present with you? Do you need me to come to the appointment? Do you need me to actually change something that I'm doing because, I'm snoring? So maybe we need to talk about sleeping in different bedrooms because your hormones are really impacting your sleep. And maybe I need to just kind of swallow my own moment of going, I don't want to sleep in a different bed so that I can honor that you need sleep, right? Those conversations that really just elevate up this experience that says, I'm here and I want to understand what you're going through. So much of perimenopause and the menopause journey throughout history of time, and it's changing, thank goodness, is the put it away, put it in the closet. I don't want to hear about it, right? Kind of silently suffer. And as partners, just showing up and saying, I don't want you to silently suffer, I think is incredibly powerful.
I love that. Thank you.
Yeah.
I was asking that for myself, but also, I wanted those who are attending our webinar to feel like maybe they have some tidbits that they could take back either to a
Yeah.
partner or maybe a friend who is
Yeah.
feeling the difficulties behind communicating how they're feeling to family, because
Yeah.
that can be a really tough conversation. And something I had kind of said at the beginning. I don't remember quite when I had said this, but talking through the type of care that Genev provides, both from our doctors and our registered dietitians, it's the type of care that our patients need. But we would hope those that are attending who have not yet seen us, they're getting that level of care that they need. But more importantly than that, it's the level of care that they deserve, and they deserve to feel
Absolutely.
heard and deserve to feel like their symptoms aren't just being put in a box, or like you had said, just being put away in the corner, just not to be looked at, not to be seen, but to be ignored and just silently go through something. And that's not what our hope and desire is here at Genève. So thank you.
Absolutely. Yeah.
Um, One more question had come in,
Mhm.
and meant to say this before I started peppering you with these questions was if anyone else has any other questions, or even as we've been answering a question maybe that you've already put in and something maybe came top of mind and you thought to yourself, I'd like to ask that, but I'm unsure. We do have a Q&A that you can plug something in it. If you'd like for that to be anonymous, it can give you the ability to put it in anonymous. And so I want to empower you to ask those questions. We have about 5 minutes left, and so I just want to make sure for anyone that maybe is sitting there with a question that they're unsure of how to ask, this is a place for you to get that answered. But
Mhm.
this question specifically pertained to physical fitness training. So, what expertise, if any, does Genevieve have in physical fitness training during perimenopause?
Yes, great question. So our the director of our nutrition and lifestyle care team, Stacy Kazanchuk, is has a degree in exercise physiology and has worked in training and is an absolute guru of both a combination of nutrition and exercise support. She's a real a real overachiever in that sense, and if she were here, she would laugh at that too. So she leads our guidance and our strategy in terms of thinking about how best to support what is going to be optimal as we think about, what has the evidence told us is best for women in exercise. For example, we get questions like, is fasted exercise the right thing to do? Should I be doing low impact cardio versus high intensity strength training? Questions like that. We have guidance and evidence to support how we educate and support our patients. Um, and it's not always appropriate for each person to apply them cookie cutter style. So we get large scope guidance and training on that front. So training from the top down to all of our dietitians. And then we use our clinical expertise to then sit with the patient and say, where are you in your journey? And what is the first step? Right? We might sort of project forward of like, this is where you're going to be in a couple months, but this is where we're starting right here and right now.
I love that. I think, from what I'm hearing you say, but also from the presentation, it's about that journey. And again, it's unique to every patient that you're meeting with, but, having a starting point as well as objectives and goals that someone could obtain in their journey, and then maybe reaching an endpoint, I think is really empowering. And I love um, just the well-rounded approach. As we kind of wind down here, I did want to go ahead and make it a point to add just our last poll question for the day, as it kind of closes this out, so to speak. But really, we just wanted to hear from you in regards to today's webinar, if you felt like it was beneficial. And so feel free to input that at your leisure. I'm still gathering some questions here, and we'll, of course, leave some time for that poll to be answered. But of course, going to make sure all the questions are addressed. Someone had asked, Jessica,
Mhm.
is there a way to prolong the perimenopause phase? And if so, does Genev provide services to assist with this?
Oh, great question. Um, I will have to say that it would be great to have one of our medical support teams with me to answer this conversation, but I will answer to the best of my knowledge and highlight any areas where I'm unsure. My understanding is the process of perimenopause is the ovaries starting their retirement, right? If we think about a body, and please just go from the physiological perspective of the statement, a body with ovaries designed to carry a child and nourish a child versus post-menopause, no more fertility. Right. So the ovaries are kind of going through their retirement. They're slowing down, reducing their hormonal output and reducing their egg output. That process is controlled by genetics, essentially. There may be factors that come into play. We know that there are some sociocultural factors that play into when perimenopause starts or the intensity of the experience. For example, Black women have more intense and I believe earlier menopause than white women. And I want to be very clear that that may be slightly, I may not be saying that exactly right, but there is a factor of sociocultural experience that plays into the stress levels and the hormonal levels that may come into play. Um, I believe there's some startups and some conversations like happening in Nat Geo magazines and things like that. Like, can we prolong ovarian function? Uh, I don't believe there is a succinct answer to that yet in terms of yes, we can. Um, inevitably, everyone born with ovaries will go through the menopause experience. Granted, we're gifted the opportunity to live long enough. And so it is unavoidable, I think is the answer, the big answer to the question.
Wonderful. Yeah, thank you, Jessica. I know that question could be as open-ended as the response, and so I appreciate the discretion there. So it's kind of the conclusion of today's webinar for the month of June that Genevieve has hosted on lifestyle support for women in menopause, both perimenopause, menopause, and postmenopause. And so, again, as you are exiting and as we are closing this out, please feel free to go ahead and just input your answer in our last poll question of the day, which was I felt today's webinar was beneficial to me. We just gather that information in order to just tailor our webinars moving forward for the audience that's participating. We want to make sure that you are feeling heard, that you're of course feeling seen, but that it's feeling maybe a little bit more specific to maybe you and your journey as you're able to answer the question that's been really top of mind. I wanted to call out as well that we again host these webinars every single month. We have a cadence of them being on Wednesdays at the same time. I'm on the East Coast. I know, Jessica, you're on the West Coast, right?
Mm-hmm.
So I always have to remember to say this in all of the time zones that are represented, but from 4 to 5 p.m. Eastern, 1 to 2 p.m. Pacific, and then I think Mountain Time is 2 to 3, and then Central is 3 to 4.
Yes, sir.
The math there, I think, checks out, but typically they're on Wednesdays in that time frame that I had just stated. The month of July, is going to be our Menopause 101 session, where it's just a comprehensive webinar for women, where it talks through just the natural life transition that menopause presents itself. Jessica had just mentioned all women, all those with ovaries will experience that type of natural life transition. And it's really just a comprehensive webinar designed to provide women and empower you to understand what's going to be taking place in your body. It's a unique experience. It's a unique journey to you. And so that's what July's webinar will be pertaining to. We'll have Dr. Savage from our OBGYN team doing that presentation alongside myself. And we hope that you'll be able to take some time in order to attend. That will be on July 10th. I will be sending out invites as well here shortly. So if you are interested, we'll make sure we get that invite out to you. But if you need anything additional or have any further questions, feel free to reach out to me or our Genev team at Genev Support, and we'd be happy to get you taken care of. But again, thank you so much for taking some time on your Wednesday to attend today's webinar session, and we hope that you have a good rest of your day. Thank you.
Thank you so much for joining.